Welcome to today's video about paracetamol, the safe dosage, and the dosage that can cause toxicity. We're all pretty much used to, as Arab communities, using paracetamol without any medical prescriptions at all. Even in our homes with children, when a child gets a fever or shows any symptoms of a respiratory infection, or any symptom involving pain or high temperature, we automatically use paracetamol. It's the same idea for adults. These medicines are found in every home, and almost none of us is without paracetamol at home, regardless of the brand or the name. Some have Panadol, some have Apmol, some have Paramol, and some have Doli. Of course, there are so many different companies. So what exactly is the problem, and what is the idea behind paracetamol poisoning? Paracetamol is a very safe medication as a pain reliever and fever reducer, but only with certain precautions. And these precautions vary depending on age or weight, and also depending on whether a woman using it is pregnant or not. So, what's the point here, everyone? Right now, almost all of us use paracetamol without consulting doctors or even knowing whether the dose we're taking is actually appropriate or not. So, how often should I take it? Should I take 1 tablet or 2? How long should I wait before repeating the dose? Alright, let's agree on this. The doses of paracetamol available in pharmacies or produced by paracetamol manufacturers are generally divided into 500 mg tablets and 1000 mg tablets. For example, these are 500 mg like Panadol Advance, Abmol, and so on, and Star, among others. So what is the dose that we're supposed to take, doctor? If I have a headache or a fever, of course, in addition to the fact that you should consult a doctor so you know your diagnosis, the dose you should take, and the appropriate treatment. But let's talk in general about the safe dosage, regardless of the reason you're using it for. For adults, whether women or men, the recommended dose is as follows. You shouldn't exceed 4 grams in 24 hours. So what exactly does 4 grams in 24 hours mean, doctor? So, if I'm taking tablets with a strength of 500 milligrams, my maximum limit is 8 tablets in 24 hours, no more than that. Now, if the tablets I'm taking are 1000 milligrams each, then 4 tablets is the maximum in 24 hours, provided that the doses are spaced out. That means I can't, for example, take 2 grams in a single dose, that is 2 of those 1 gram tablets, or take 4 Panadol Advance or Paramol tablets at once, for instance. Not even 3 tablets. The maximum dose at one time is 2 blue Panadol tablets or 2 Paramol 500 tablets, or just 1 1000 milligram tablet, for example. I'm not advertising for any companies. We're just trying to give examples so that everyone can visualize it. Practically speaking, that's the maximum dose per intake, from 500 to 1000 milligrams, meaning you shouldn't exceed 1000 milligrams per dose, and the doses should be spread out over 24 hours. That's why the dose is 1 gram every 6 hours. So, for people who get a fever and are in a hurry for the next dose, like they took a dose, now their temperature went down, but after 3 or 4 hours, the fever comes back up. The safest and best thing is not to take another dose of paracetamol right now, and instead to handle it the way we all grew up with, using cold compresses or sitting in water so that the fever goes down more quickly. Or, as some doctors do, we alternate between different fever reducers. For example, giving you paracetamol in rotation with another active ingredient like ibuprofen. But let's get back to paracetamol. As we said, the maximum dose is 1 gram at a time for adults, and in a 24-hour period. That's 4 grams total. We shouldn't exceed that. Now, if the adult in question is a pregnant woman, we're even more cautious. So if she doesn't have a high fever, it's better not to reach 4 grams. Let's make our maximum 3 grams, or even 2.5 grams, if there's no fever. That is, if the reason we're taking the medication isn't related to a fever. But if there is a fever, fever during pregnancy is one of the dangerous things, so in that case, we treat it just like we would with other adults and say the maximum is 4 grams in 24 hours. Of course, as we agreed at the beginning, each of us should consult our own doctor to know exactly what the diagnosis is, which symptoms fall under which diagnosis, and what the treatment plan should be. But as we said, we're speaking in general terms if you are acting on your own. As for pregnant women, we said we don't treat them the same as usual. If there is no fever, we try not to exceed 3 grams as much as possible, and the dose should also be divided. Alright, now let's move on to children. The concentrations of paracetamol in pharmacies depend on the manufacturing company. For example, a company might have 100 milligrams in 5 milliliters. There is usually a cap on the bottle marked with the dose, or we give it using a syringe without using its needle. Let's avoid using a spoon, because sometimes every household has spoons of different sizes. So you might find that a small spoon at one person's house holds 3.5 milliliters, while at someone else's it holds 5 milliliters. A large tablespoon might be 7.5 milliliters at one place, 10 milliliters at another, and sometimes even less. That's why we should use the measuring tool that comes with the bottle, or the cap that has the measurement marks. So, to repeat the concentrations of paracetamol for children from the beginning, some companies make it as 100 milligrams per 5 milliliters, some make it 120 milligrams per 5, some 125 per 5, some 160 per 5, and there are even some with 250 per 5. Children's dosage is a bit sensitive, and we can't just use a general dose like we do with adults. Why? Because it's tied to the child's weight and the calculation for it. Of course, there are now new apps that can calculate the doses. And there are some parents who are a bit skilled, and their doctor teaches them how to calculate the dose based on weight. But generally speaking, is 10 to 15 milligrams per kilogram. But again, it's best for children to consult our doctors so they can do the calculation. Now, the toxic dose for children is very high. It can exceed 100 milligrams per kilogram in 24 hours. And that's a very large dose, and it's hard to reach it. But since, unfortunately, we often don't realize that paracetamol is present in some of the medicines we give our children, like cough medicines, cold medicines, or decongestants, we find, by mistake, that these children come to us. When they come to the clinic, for example, we see that the father gives them paracetamol as a fever reducer, then gives them cough medicine that also contains paracetamol, then gives them cold medicine that also has paracetamol, and they don't know. So, the total dose the child receives throughout the day ends up being a very large amount of paracetamol. That's why anyone giving medicine to a young child must know all the medications, their concentrations, and what they contain. And they should consult a doctor before giving any medicine to a young child without knowing these things. So now we've talked about the dosage for children, the dosage for pregnant women, and the dosage for adults. Now, there's an important point regarding the elderly. Many elderly people experience weight loss, or their body structure becomes less than it was when they were younger. As we get older, sometimes we become a bit weaker, and when we sit for long periods and don't use our bodies well, our muscles and weight decrease, or sometimes they have chronic illnesses. And chronic illnesses can sometimes affect the liver. That's why, with the elderly, we worry and treat them like children or pregnant women, meaning we reduce the maximum daily dose to 3,000. If I'm treating them like a pregnant woman, I won't exceed 3,000 per day, which is 3 grams, or 6 Panadol 500 milligram tablets, or 3 of those other tablets. Unless the elderly person is someone I'm sure doesn't have any chronic illnesses affecting the liver, has a good physique, and a healthy weight. Almost every household has paracetamol. There's hardly anyone who doesn't have it at home. We're reminding people again. Consult your doctor before using any medication, unless your doctor has already trained and instructed you on how to use it. And you know the concentrations of the medications you have. If you have children, you know what's in the medicines. If you're giving medicine for a cold, runny nose, or cough, make sure to calculate it properly. I hope this video was helpful. For those of you who have any questions, leave them for us in the comments and we'll answer them in a video. This was the first video in the series about medication use and drug safety. If anyone has a medicine they'd like us to talk about, write its name for us in the comments. If you haven't subscribed to the channel yet, please do so to get all the new videos. And for those who are already subscribed and found the video helpful, please hit the like button and share this video with anyone who might benefit from it. See you soon!